Megavanen, lords and ladies. This was one of the most common wounds or injuries back in the 13 and 1400s. And that's what we're going to talk about today in this episode, are wounds and injuries back in the Middle Ages, how we took care of them, and how you can take care of yourself today. Arrows. We don't see too many of these nowadays, but back in my day, about 1348, this was the most common way of killing your enemy. This point was one of the most common types of points used back then, and for its type, it was not terribly difficult to remove. Those were the most inflicted type of wounds during the wars of the 1300s and 1400s. And surgeons back then had to learn how to remove arrows from a soldier in the field without killing them, because depending on the type of arrow, if you didn't remove it correctly, they would bleed to death and there would be more wounds just from the removal of the arrow. So it seemed every time that a surgeon would learn how to remove a particular arrowhead, a new one would be developed, and so then the surgeon would have to relearn all over again. So puncture wounds such as arrows and swords, the slices and so forth, were the most common type of wounds back then. All right, how did they take care of them? Well, unfortunately, they would try to use poultices, but very often they would opt for surgery, and in this case, it was usually amputation. If there was too great a wound, they didn't take the time back then to try to mend the wound, especially when you're out in the field during the middle of a war. So it was a contest very often to see who was the better surgeon. How quickly could they remove someone's limb? And the average time was about 1 minute. They would basically either try to give the individual opium, but that's only if they were wealthy. Anesthetics were only for, like anesthesia and stuff, were only for people who were wealthy. So the soldiers in the field usually were not wealthy and did not get to take advantage of that. What they usually did was take a block of wood, stick it in their mouth, close their teeth tight, and literally start sawing away. And a good surgeon was one who could do it, like I said, in about 1 minute. All right, so there were surgeons of that type. There were also surgeons called Barber Surgeons. They were literally barbers who did surgery on people. And they were often much better than the physicians back in their time. There is a story that was actually written by a barber surgeon one time where he said that 2 patients came to him in one day. One was a knight. There was a wound in his leg, a puncture wound from an arrow, and another one, a woman who came to him who had a mental disorder. All right, so what did he do? The barber surgeon took some salve that he had and put it on the wound. That was going to help heal the puncture up. He knew what to do. The wounds consisted of, again, like we talked about last season, we talked about garlic and lavender and sage, oils of that nature. All right? For the woman with the mental disorder, he basically told her to try a different kind of diet. Even back in the Middle Ages, we talked about diet was very important to one's health. Well, after he'd gotten through with all this, and he said, this is what we're going to do, a French physician showed up and said, barber surgeons know nothing about healing. Let me intercede. And he went in, and he said, that wound on the knight, it will never heal. So he amputated his wound right there, stuck him on the table, held his leg down, cut his leg off, and the knight bled to death and died. Not sure I would really go for that technique there. All right, the woman with a mental disorder, he said, no, she is possessed. Remember, this was a physician back then. She is possessed by spirits. So he did something called trepanning, which was very common then. They would literally bore a hole in your head. In this case, was to let out the spirit. Now, what do you think happened? She died on the spot. So barber surgeon versus a French physician didn't quite work out too well back then. Unfortunately, this was a very common situation. All right. So we had trepanning, which was very common. The barber surgeons tried to help. The barber surgeons at least tried to do herbal methods. There were another group of people called hedge witches. Those were basically the wise women of the village, and she used herbs. All right, and it was very common to do this type of thing back then. And hedge witches were far more successful than the physicians were back then. All right, so we talked about an anesthesia. We talked about some of the things that they could do back then to take care of these wounds, because the most common wounds, again, were arrows, were swords, punctures, slices, things of that nature. Another common wound were broken bones. When you're sieging a castle and you're going up the ladder and you're trying to climb over the walls, it was a very common injury for the soldiers to fall off the ladders, and they'd fall and they'd break their legs or break their arms. All right, and so unfortunately, no anesthesia. They would set the bone right then and there and put them in splints and send them off to a field hospital. No painkillers at all at this time. All right, sometimes the wounds healed correctly, sometimes they didn't. Well, that was that. What can we do now? Hopefully we won't do the amputations quite as much, and we've actually had some experience with that as well. One very common thing that you can do today, and this is a wonderful remedy that you can do on your own. Again, I'm not recommending you not to go see your local doctor. But if you're out in the middle of the woods and you're way out there and you don't have access to a lot of the modern health care, here's something you can do for punctures, for wounds, for burns. We've seen it very successful, and it's called a comfrey paste. This is something you can make on your own. You take comfrey leaves or roots, all right, Symphytum officinale is the type of herb I'm talking about. It is a cell proliferant. It causes cells to regrow quickly for bone, flesh, and cartilage. Make the paste. You take a bunch of comfrey powdered, either leaves or roots, mix it in with some honey, raw honey, and put in some wheat germ oil. That's it. If you have a burn or you have a wound, put that paste on it. Don't remove it every day and put a bandage over it, and every day keep applying more comfrey paste and rebandage, and keep doing this day after day, never removing what was below. You'd be surprised when you remove the bandage how much of the paste was actually absorbed. So do that and keep doing it. You're going to be amazed to see how it heals. And we have seen deep wounds, deep, second, third degree burns heal with no scarring whatsoever. So that's the comfrey paste. But what do you do when a wound is so severe that the patient has gone into gangrene? Because even to this day, the common protocol for gangrene is to amputate. We had a patient one time some years back. He'd done nothing more than stepped on a tack out in the grass. He didn't take care of it for 2 months, and it had gone into full-blown gangrene. He'd gone sepsis. He was dying. He called us to their home. We took our medical supplies, went there. I could actually look up in the wound, look up in his foot. It was rotten. It was the worst thing I've probably ever seen. Bad as an arrow being hit. So we treated him, and what we did, we treated him with the comfrey. We treated him with lots of garlic. Remember last week I told you about garlic being Russian penicillin? We treated him with lots of garlic, both internal, external, doing it right, because remember, garlic paste on the skin will burn, so we usually mix it with something, a base, so that it doesn't get directly on the skin. But lots of garlic internally. The sepsis went away. We treated his wounds with the comfrey paste type situation. But to battle the gangrene, this is a wonderful technique here. Remember this. All you need are 2 herbs. Marshmallow root, that's where marshmallows really came from. Back in our days, we literally made marshmallows with marshmallow root because it had so much mucus in it, and you could make a marshmallow. But you take 3 parts marshmallow root, 1 part lobelia. All right, lobelia is the thinking herb. It helps the other herbs decide what to do. And we made this foot bath out of this very strong tea. And he would soak his foot in it every day, hours and hours he would do this, along with comfrey in the foot bath. The gangrene literally disappeared. The wound completely filled back in and healed. He never lost his foot. He had 2 feet when it was all over with. We were very proud of him for the effort that he had to go through. Because along with all that, he had to eat a very healthy diet so that his body had something to work with. All right, so another great little salve that you can make uses comfrey, plantain, and chickweed. Mix it all together in olive oil with beeswax. We've used it on wounds and burns and scratches. It even works on hemorrhoids. Even you put that up there, it will actually help the hemorrhoid. We knew one patient that was going to have a hemorrhoidectomy. In other words, his hemorrhoids removed in 9 days. He started using the salve, and on day 3, We called the surgeon and had the surgery canceled. His hemorrhoids completely disappeared. Something as simple as that would work. All right, so that's pretty much what we would do for some simple things for wounds. One other thing I would recommend, because one of the biggest issues that can happen with wounds is bleeding out. All right, this is a miracle. We used it back in the 1300s. You can use it today. And that is the very humble herb called cayenne. All right, Capsicum annuum. Super hot, but it really doesn't hurt. Cayenne is what's called a rubefacient. That's a medical term which means wherever it touches, both external or internal, it will bring blood to the region. What does that do? It equalizes blood pressure by pulling it off of one area. It brings oxygen and nutrients to an area so it heals quickly. If you're ever in an emergency situation, you don't know the ambulance is going to get there in time, you don't know that the doctor's going to get to you in time, always keep a bottle of cayenne tincture in the house. All right? All right, what happens is if you're bleeding externally, you basically can take it and put a squirt of cayenne in your mouth. You will feel this whoosh go throughout your body. That's the equalization of blood pressure. You can literally count to 60. And by the time you count to 60, you can see that the wound has stopped bleeding or going down to a very slow ooze. We've seen it with patients who are bleeding internally to give them the cayenne orally, and it will actually stop or slow the flow of the bleeding internally. We've seen patients with heart attacks and strokes. We've actually seen this happen, that during the heart attack, we've seen them squirt the cayenne into their mouth as in 1 second. The heart attack or stroke stops. Instead of having those golden 4 minutes, you might have a golden 20 minutes. Save the patient's life long enough to get to the hospital. Because what it does if they're having a heart attack and you squirt this on their tongue, it pulls the pressure off the heart. If they're having a stroke, it pulls the pressure off of the brain. It gives the patient enough time for you to get them to the hospital. We've seen it work time and time again, and I can say, in 20 years of practice, I've never lost a patient to a heart attack or stroke. It's something more, nothing less than the lowly herb cayenne. All right? So there's some real simple things that you can do at home. Remember comfrey, remember cayenne, marshmallow root, lobelia. These are all wonderful herbs that you can use. All right? Well, last week we talked about a poem or a riddle about the king and who that was, who that king was. Well, one of you got really, really close, and I appreciate you commenting and letting us know. But just so you know, the actual answer to the riddle was the King of Hearts. All right? He builds a house of cards. All right? I know, it's a medieval riddle, and we were a little more obscure back then. All right, so that was it, the King of Hearts. Riddle for this week. Let's see if you guys can get this one. Okay, and again, if you have any ideas, post under the comments. Let me know. If you get it, I'll mention your name next time. All right, and next week. So here we go. I tolerate the moon and stars. I can't abide the sun. Banish me with torchlight, and you will see me turn and run. What am I? All right? Don't be afraid. Don't be embarrassed. Just pop in your ideas. It might be a better answer than what it is. But try that and let me know. And if you get it, I'll tell everybody next week. All right, so that's this week's. It was a pleasure seeing all of you lords and ladies here today. I look forward to seeing you next week. In the meantime, you have a most blessed rest of the week.